Okay, so we record now. So if you wish to go to your Arabic lesson, revision lesson, that's fine, but we'll carry on with our health science revision now. So just to reiterate what they have told you, the question timers will be removed for this exam. So you will have an additional, you'll have one overall time for the whole exam. So that means that you can go backtrack is enabled. You can go back to revisit questions that you've answered. Okay, and then you will have an overall exam time of an additional 15 minutes, so 75 minutes in total, and the same 20 multiple choice questions. Okay, so guys, I'm going to be having this on full screen. If you have any questions, just open your mic and ask, okay? Otherwise, I'll just carry on. We have a few questions, so I will ask you if you can answer during the presentation. So please read each question carefully. Make sure that you understand the question and then read through all of the answers before choosing one. But make time to go back and check your answers if you're not sure. So make a note of the ones you're not sure of, and then you go back and check your answers because you have the option of doing that. And then the multiple choices, there should be just one answer, okay? Unless it says to choose more than one, but I believe it's just one answer. Make sure that your laptop is charged as well and that you know your username. Obviously, you were given your passwords on the day. Okay, so medical terminology was the start of the unit. We were looking at root words, the parts of a medical term, which is the root word, the prefix, the suffix, and the combining vowel. Okay, so the prefix is at the beginning, the root is in the middle, sometimes the root is at the beginning, and the suffix is at the end. So you can see in these puzzle pieces here how it all goes together, okay? All right, so in these choices below, which of the following is a suffix? Okay, so does anybody want to answer? How would we recognize a suffix?
Hypo.
Emia.
Emia, excellent. Yes.
So pathy and cis.
Yes. So the suffix is at the end of the word, and usually you have the dash in front of the suffix because something is coming before, okay, and at the end. Okay, so medical terminology, in your revision sheets, you've got a number of the terms. They're also in Arabic to help you, and you've got them broken down by prefix, root word, suffix, and combining vowel, if it has one, okay? So some of the most important ones, I think this one was on your last exam, hyperglycemia. So hyper is the prefix, glyce is the sugar, and emia means in the blood. Okay, so high sugar in the blood. Bradycardia means Brady is the prefix, it means slow, and cardi is heart. So please familiarize yourself with some of these main terms. And in the revision sheets, there were some images as well. So osteo, somebody's used some visuals to help you remember some of the words. So sugar, glucose, myo, muscle, and of course, inflammation, okay, pain. If you think of a flame, inflammation, this is itis. So joint, arth, and so on. Okay, so useful thing here is you've got the Arabic word as well. So try to remember these. Carcin, meaning cancer, and so on. Okay, so again, you've got these columns. These are some more of the medical terms where you've got the word, and then it's broken down into its combining parts. So let's look at some here. Carcinogenic. So carcin, it's beginning with a root word and ending in genic, which means forming. Okay, and there is a combining vowel in the middle here to join the root word and the suffix. Okay, so I believe this question was in your first exam. So which of the following is true about combining vowels? Are they placed at the end of the word? Are they to connect two root words? Does it make the medical term harder to pronounce, or is it changing the meaning of the word?
Connect two root
Vowels
words.
are used to connect two words.
Yes, excellent. That's right. So they are connecting two root words and making them easier to say. Okay, so the meaning of the medical term hypotension. What do we call hypotension? So if you remember, we have hypertension. What does hypotension mean?
Low blood
Low
pressure.
blood pressure.
Yes, good. Low blood pressure. That's right. Okay, so I think we've had this one in class a couple of times if I've gone through the matching for you. So the first one here, what did we say?
Carcinogenic.
Yes. So what
Cancer
is
forming.
cancer forming? Right. That's right. And then leukemia.
A disease of
Leukemia.
the nervous system.
No. So Luke.
Cancer of the blood.
That's right. So emia here is part of your clue. So if you say, if you see blood, then you know it must be this one. They call this Luke is actually talking about some blood cells. And so that's what it's like, cancer in the blood. Okay, when you have lots of these types of cells in your blood, that means cancer. And then earth, what do we say earth means?
Joint.
Joints, exactly. So you're looking for that word joint, and that's your clue. So itis meaning inflammation, arthritis. And then osteoporosis.
Condition of the bone.
Bone.
That's exactly, bone, osteo. And then neuropathy,
Nerves.
nerves, that's right. And pathy means the disease, pathy. Okay, so which of the four below are suffixes? I think we've, okay, so not four, sorry, there's just two. I've changed this around a bit. So which two are suffixes?
Logi and ism.
That's right, logi and ism. So what does logi mean? Does anybody remember what logi means?
A study of something. Study
Yes, a study.
of.
That's right, study of, that's right. So if we said biology, we mean the study of life. And biology doesn't have a combining vowel because it already has one, bio. And then ism is used for a condition. So if we had hyperthyroidism, we mean it's a condition of the thyroid, which is too high. Okay, so too high thyroid. So ism is condition. Okay, and psych was the mind, phleb was vein, and thromb was clot. So you can go back over your word lists to look at some of those. Okay, so what did we say is the suffix that means disease?
Pathy.
Pathy, that's right. Pathy means disease, like neuropathy. Okay, and then you guys all should know this one, the medical term, the main part of a medical term that has the most meaning is known as the
Suffix.
Root word.
The root. That's right, the root. So the root, when we think of the root of a tree, it's giving the life to the tree. So when you have the root in a word,
Good
it's
evening,
giving.
Mr. Heather.
Yes. Good evening. Good evening. Who's that?
Heather.
Okay. All right, guys. So so if you haven't already, this is the revision file that I'm going through. If you want to practice after, and also we're recording the session, okay? Just so that you know, and you can have it afterwards. So medical record report. This was something we discussed after we looked at all the medical terminology. So when we think about a medical report, the personal information is the specific information about you, your name, your age, your date of birth, your male or female, and where you're from, your nationality or ethnicity, your origin, and your contact information. When we talk about medical history, it's what's happened to you in the past. So your conditions that you may have, maybe the medications that you take, and also any allergies that you have. So this is very important for the doctor to know what he can and cannot give you. And then your medical complaint is why you are going to see the doctor. So it may be some of the signs, some things that the doctor sees, or the symptoms, some things that you feel. And then he will do a physical examination and he will record your vital statistics. And these are your things like blood pressure, pulse rate, or your heart rate, your respiration, your temperature, and then maybe your height and your weight as well. He might take your blood pressure as well, and then examine any of your body systems. Okay, maybe you have a lump that he has to feel, and then he may do some tests. So in the part of the medical report, the results would always have any tests that he's done or any diagnoses, okay, any conclusions that he's come to about your condition. And then in the treatment section is where he would put your medications and the progress that you're making and anything like that. Okay, so that's a medical record report. So which of the following is not found on a medical report?
Diet.
Diet.
That's right. That's right. So we would always find a date of birth, contact information, and gender, but we wouldn't necessarily find diet. Okay, so again, here are some more medical words. This is under the responding to medical instructions. So if the doctor has perhaps discussed a prognosis with you, he means that he's telling you about the outcome. So after you have your treatment, what he thinks will be your outcome or your possible recovery from the disease. Okay, that's your prognosis. And then let me see, what else can I discuss here? I think we've covered most of those. So if we say a disease is a terminal illness, okay, having this illness that cannot be cured, is that true or false? A terminal illness means having an illness that cannot be cured. That's true. That's right. Oh, okay. Sorry, I clicked too soon. So a prognosis means an opinion of the outcome of the disease. Okay, so this is what the doctor would say, how he thinks you're going to recover. Okay, whether or not you will be cured or so on. So that is true. Okay, so a something is the disease that explains a person's symptoms. Wait, no, sorry, this is not right. Sorry, I've got a typo in there somewhere. So what is the word that means something that explains a person's symptoms? Yes, that's what I mean.
Sign.
No, so this is what we call a diagnosis. So a diagnosis is the explanation of a person's symptoms. Okay, sorry, I shouldn't have the disease in there. I'll correct that. So this is what the doctor thinks is wrong with you. He's looked at your symptoms. Maybe he's looked at your signs as well, but he's come to a conclusion about this disease. Okay, so this is what we mean by diagnosis, when he diagnoses a disease. And medical history, I think we've had this one before. Medical history in a doctor's report includes medical conditions, medications, and something. Is it name, gender, allergies, or symptoms? What do we have in the medical history of a doctor's report?
Allergies.
The allergies, that's right. Okay, and the root word hyperglycemia. So what is the meaning of the root word in this medical term?
Sugar.
Sugar, that's right. Right. And so if I asked you what is the meaning of the suffix in this word, what would you say?
Suffix emia, which is blood.
Yes, excellent. That's right. Okay, so I think a couple of these terms were in the last exam, so I wasn't sure that we went over these before. So lipid, does lipid mean fat or above?
Fat.
Fat, that's right. So lipid is fat. So epi, if we think about epidermis, we mean it's above the skin. Okay, and
How is it used in epidemic?
oh, epidemic. Yeah, so I don't know. So epidemiology is the study of disease in the population. So maybe it's looking at, I don't know, above. Maybe it's looking at in an above way, in a overall or a big view, maybe a big view above the whole population. So epidemiology. So I'm not sure about it. I'm not sure what it means in epidemic. I'm really not sure. I have to look that up.
But it was explained to us that it means like it covers a lot of regions, something like that.
Okay.
Yes.
Okay. So if it's epidemic, so maybe it's above and covering. Yeah, when you talk about epidemiology, it's studying a very large group of people. So maybe it's the same thing with epidemic. It's a large population. Okay, so the second unit was on these diseases and disorders. So which of these correctly defines disease? Is it a medical condition that stops the body? Yes, or is it a disruption?
Yes.
Disruption. Yes, so it is the medical
Disruption
condition
is disorder.
That's right. So that's why I've underlined these words here. So disruption is what happens. Yeah, that's what happens when you have the disease, right? When you have a disordered function is because you have the disease. Okay, so here are this is just an overview of the disease unit. Okay, so we talked about whether something can be spread or not spread. Okay, so if a disease can be spread, we know that it's communicable. If it's a disease that is not spreadable, okay, or infectious, then it's non-communicable. It cannot be spread. So the diseases that we looked at that were communicable were the flu and the pneumonia. Okay, this was the disease of the respiratory system. It could be by a virus or bacteria. And then gastroenteritis. So this would be something we've eaten and maybe we're getting sick. And this is also highly infectious. And of course, malaria too, which is the viral one that can be spread through mosquito. Okay, so the ones that are not communicable, we looked at epilepsy. We're going to look at some of these other types of nervous conditions in a moment. Hypertension and heart disease, diseases of the circulatory system, and multiple sclerosis. So this is a disease of the immune system, okay, but it affects our nervous system as well, okay? But it is a disease, it is known a disease of the immune system. So that may be a bit confusing sometimes. So diseases for the period of time, we said diseases that are less than 3 months, they are short-term diseases, and diseases that last 3 months or more are long-term. So these are chronic diseases, or else they're acute diseases. And here are some examples in your sheet. Okay, so let's look at some specific questions now for several diseases. So we said that a disease that is short length of time is acute.
Acute.
That's right, acute. So let's look at the individual body systems and the diseases that we studied in each of those. Okay, so we'll take them one at a time and we'll talk about these individually. Okay, so first of all, this is something that stops a disease and makes someone healthy again. What do we call it when something is resolved? If we get rid of a disease? A cure, that's right. Yeah. Okay, so first of all, the circulatory system. So this is the system that's pumping blood around our body and bringing oxygen and nutrients. So it sends out the blood with oxygen and then it comes back through the veins. So it's providing oxygen and nutrients, and it includes the heart, the veins, and the arteries and the blood. Okay, so the two diseases we looked at were hypertension and atherosclerosis. So hypertension or high blood pressure, it can affect anybody, but it usually happens if you're overweight or maybe you have family history. And it can also be caused if you have high levels of stress. Okay, so if you're very stressed out, you can increase your blood pressure that way as well. So some of the signs, things that you may feel or hear, so you might have a headache, you might have vision problems, okay, blurry vision, or you may have some pain or difficulty breathing and feel pain in your chest. So there are medications and there are lifestyle changes that you need to make if you have high blood pressure. And the same goes for heart disease. So if there is heart disease in your family, it can also increase your risk for heart disease, but it doesn't mean that you get it. So it means that if you have atherosclerosis, it means that you have a buildup of fat in the artery. So it looks like this, and it's narrowing the artery and stopping the blood flow. Okay, so if it stops it in the heart, it could be a heart attack, but if it stops it or blocks it in the brain, it could be a stroke. Okay, so it's like a heart attack in the brain is what the stroke is. So if you have a heart attack, you could have severe pain in your chest. And if you have a heart attack, or if you have a blockage of an artery in your brain, this may cause weakness and loss of vision and difficulty speaking. Okay, so lifestyle changes and medication are indicated for both of those as treatment and also surgery to remove this blockage. Okay, so that's the circulatory system. Okay, so what did we say the circulatory system includes? The heart, the veins, the arteries, and something else.
Lungs. Lungs.
Oh, no, not lungs.
Muscles.
No, it's not the muscles. That's part of the musculoskeletal system.
Blood.
The lungs are blood. Yes, the blood. So the circulatory system it needs to move something around your body. The blood is what carries all of the oxygen and nutrients. Okay, so this is the same question. So this is the way it was worded on your exam. So the circulatory system is a system of blood vessels and organs, so the heart and so on, through which your blood flows and oxygen and nutrients are transported through the body. Okay, so what did we say the two diseases of the circulatory system are?
Hypertension and chronic obstructive pulmonary disease.
Okay, you've got one of them right. That's hypertension. But the other one is atherosclerosis. So that was where we had the narrowing of the arteries with the fatty buildup. So the chronic obstructive pulmonary disease is the respiratory. It's the respiratory. It's in our lungs. That's where the problem is. So your lungs, although you're getting oxygen into your body, it's not part of your circulatory system. It's part of your respiratory system, your lungs, okay? Right, so musculoskeletal system now. So we have that made up of bones, which we have 206, and then we have joints and ligaments and tendons and cartilage and muscles. All of those things together make up our musculoskeletal system. Okay, so the function is to provide form, to provide stability so that we can hold ourselves up and support our movement, okay, and allow our body to move. So we had 3 diseases of the musculoskeletal, which was arthritis, osteoporosis, and sarcopenia. So I'm not going to go through all of the information on here, but what we have here is who it affects, okay? So generally, it affects more women than men, the arthritis, okay? But if you have osteoporosis, again, it's also if you are female, we get unlucky with these 2 diseases, females. But sarcopenia can happen to anyone over the age of 75. So if we have arthritis, we might feel pain, we might have stiffness, we might have a grating sound or a rubbing sound when we walk. Okay, it can be very painful. If we have osteoporosis, we might have back pain as well, but we might be stooped over, okay, like this, like the curved spine. And so then we might lose height. And also importantly, our bones are more easily fractured, okay? They're very weak bones. They're very porous. For sarcopenia, we would have difficulty walking because our muscles are compromised, okay? So our muscles are weaker and we have difficulty doing everyday things like walking or just everyday tasks like holding something heavy. So we treat most of these diseases with medication, okay? But we also have to do things with our diet. So we have to eat enough calcium and vitamin D for our bones, and we avoid fizzy drinks and caffeine. And we also importantly do weightlifting, okay, for strengthening our bones. And also for arthritis, we would do physical therapy. So we do exercises as well to strengthen. And that's the case for sarcopenia as well. We need to do strengthening exercises and physiotherapy. Okay, so for osteoporosis, what do we say? How do we manage osteoporosis? What do we do as treatment?
Getting enough vitamin and calcium.
Yes.
And doing weight, being physical activity, running, walking, aerobics, and weightlifting.
Yes, excellent. Yes, so be energy. That's right. Okay, and what did we say then? What do we say that is the musculoskeletal system then? What makes up the musculoskeletal system?
Muscles and bones.
Bones, muscles, tendons,
Tendons.
and cartilage.
That's right. So those four things, that's right. Okay, and then this term describes the loss of muscle strength and muscle mass. So that is the amount.
Sarcopenia.
That's right.
Sarcopenia.
Mrs. Heather,
yes.
I think there was a review PDF for the 3 chapters that we have.
Yes, there is.
Do we still have it on Teams?
Yes, it's still under Teams. Yeah. So what I did is I took some of those. I took some of the print screens from those files. So those review sheets are still there, but I put them in here as well. Okay, so I've just given you the answer here, but which of these is not a symptom of osteoporosis? Is it tingling in the fingers? Is it back pain? Is it stoop posture, or is it loss of height?
Tingling fingers.
That's right. So when would we have tingling fingers? Does anybody know?
That was Parkinson.
Yes, we would have tingling in our fingers or a loss of feeling in our peripheral, in our ability to walk and so on. That's right. And then which of the following chronic diseases causes bones to become weak and porous?
Osteoporosis.
That's right. So it's just worded a little bit differently, but a lot of these questions are the same. Okay, so let's look at the nervous system. I'm just wondering how much time we have here. Okay, so the nervous system, we have the central nervous system. And if you remember, this is including the brain and the spinal cord. And then we have the peripheral nervous system, which is all the other nerves going out to our arms and our legs. Okay, that's the peripheral, or other words, all around. Right, so the function of the nervous system is to carry information to and from our central nervous system, allowing us to walk, allowing us to feel, okay, and telling us how to react. So if we touch something hot, it's telling us to remove our finger, okay? Tells the body how to react. So the diseases that we looked at under the nervous system was epilepsy, Parkinson's disease, and Alzheimer's disease. So epilepsy is a chronic abnormal brain activity, okay? This is characterized by abnormal brain activity, and sometimes it can lead to seizures, okay? So if there's abnormal electrical activity in your brain, this can lead to seizures. And some of those signs or symptoms of somebody having an epileptic seizure, they may fall down and feel dizzy. They may start shaking, and they cannot respond to you. Okay, they cannot respond. And so if we were, okay, we'll talk about how we respond in a medical emergency in a little bit. Okay, so that is seizures. Parkinson's disease, this is the disease that slowly breaks down our ability to communicate with the rest of our body, okay? So sometimes the message is getting through and we would move our hand, and then other times it's not getting through. So this causes shaking. So it's kind of like this intermittent pause button on your nervous system. So it can cause shaking. It means that you might have difficulty concentrating. Okay, so it can happen anywhere in your nervous system, in your brain, in your spinal cord, and it may cause us to freeze in our movements. And it actually also affects your smell and your sense of taste as well. Okay, so we know that there is no cure, but it's managed with medications and exercise. And same thing for epilepsy. People are on some medications to manage their electrical activity in their brain, and they also have a special diet. So they have very low carbohydrates. Oops, sorry about that. So finally, Alzheimer's, this is the degeneration of the brain cells, okay? So this is just to do with your brain. It causes memory loss, and you would forget somebody's name, and you might forget where you are, and you might have problems with your mood as well. So there's no cure for Alzheimer's. Some medications can slow down the progress, but again, it affects many people who are aging, just like Parkinson's. So most people over the age of 60, but for Parkinson's, mostly men are affected. And for Alzheimer's, it's anyone over the age of 65. Again, to do with your family history. Okay, so two forms of treatment to help manage Parkinson's disease. What did we say are the two forms of treatment for Parkinson's?
Physical therapy.
Yes, physical therapy.
Medication that help with movement.
Yes, that's right. So medications for movement and physical therapy for your strength. Okay, and then the next question.
Recorded.
Something. Yeah, so I'm recording this session, so it doesn't have to be re-recorded. So this is a chronic degenerative disease of the central nervous system, so including the brain and spinal cord, and it affects a person's movement and mobility.
Parkinson's.
Parkinson's?
That's right, it is Parkinson's. Okay, so what did we say this central nervous system was made up of? Is it made up of the brain and spinal cord, or is it the nerves away from the central part of the body? Which one is this?
This is made up of the brain and central nervous system.
That's
Central
right.
nervous
So
system, yes.
Central in the center
Okay.
and peripheral in the periphery. Yeah. Okay, so true or false? Forgetting people's names and memory loss are symptoms of Alzheimer's disease. Is that true? It is true. And then forgetting people's names and memory loss are not symptoms. Oh, wait, no. I've got
Maybe false. Maybe.
Yeah. Sorry. I think I was trying to decide which way I would would write that question. So yeah, just make sure that when you're reading the question that you're looking for those not parts of the sentence, because maybe they will make your answer the opposite to what you thought it would be. Okay, so choose 3 answers below that are signs and symptoms of Parkinson's. What did we say were signs and symptoms?
Tremor, shaking
Tremor,
hands.
hands,
B,
freezing.
D, and E.
B, D, and E. Well done. So freezing, not able to move, losing your sense of smell and taste, and also shaking. Okay, so respiratory system. So we were looking at, this is a system that allows us to breathe and provide oxygen to our body. So we looked at asthma and chronic obstructive pulmonary diseases. There was a couple of those, and pneumonia. So asthma first. We know that this is the inflammation of the airway, so making it very difficult to breathe. So it's actually making a smaller opening inside the bronchial area. Okay, so the part leading to and into the lung. So this can affect anyone from the age of a child up to adulthood, but it usually passes down in families. Okay, some of the things that you would see if somebody has asthma is that they are wheezing. Okay, they can't get a breath. Maybe they are coughing. Okay, they could be coughing at night. So they have to be on long-term medication and oftentimes use an inhaler. Okay, so they have to pay attention to their diet, get regular physical activity to keep their lungs strong, and they have to stop smoking, obviously. So chronic obstructive pulmonary diseases, this is what we call COPD. So again, this is causing difficulty breathing and also breathlessness, okay? So somebody would have to be on oxygen. They will gradually get worse and worse and worse. So it includes bronchitis. So this is inflammation of the bronchial tubes leading into the lungs, and also emphysema. So emphysema means that part of your lung has actually died, okay? So you can no longer get oxygen in certain parts of your lung. So whereas bronchitis is just inflaming in this area like asthma, emphysema is long-term damage. So maybe somebody lived in a polluted area for many, many years. Okay, maybe they smoked. And sometimes asthmatic people can develop emphysema as well. So it can begin quite early, like in your 30s or 40s. And again, very similar symptoms to asthma. So these people who have COPD, they need medication, okay, to keep their airways open. They have to quit smoking, and obviously they use similar medications to manage the inflammation in their lungs, okay? So this allows them to breathe. And then finally, pneumonia. So this can be caused by a virus or a bacteria, but it is an infection in this area. So if we look inside your lungs, the very, very end of the little branches, this is where we have the air sacs, where the air is exchanged and the gases come out. Okay, so this could be infected here, could be infected and filled up, so air can't get exchanged. So this again can also cause shortness of breath and pain and confusion. If you're not getting enough oxygen in your brain, it can make you feel confused. If you have an infection, of course, you might have fever and sweating and chills. Okay, so if you have mild pneumonia, it can be treated at home with antibiotics, but sometimes it is life-threatening, just like COVID-19 is affecting your lungs, and you would have to be on a ventilator in a hospital. Okay, so that is the respiratory system. So questions about that. So a chronic disease that causes inflammation of the airways. So as the airway becomes inflamed and swells and makes
Asthma.
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 Yeah. Okay, and what did we say COPD stands for?
Chronic obstructive pulmonary disease.
Chronic obstructive pulmonary
Disease, yes, you'll never forget that now, will you? Okay, so true or false? Pneumonia is a communicable disease. Is that true or false?
I would say false.
Okay, so if it's caused by a bacteria or virus.
Communicable.
Yes, it is true. So if it's caused by a virus or bacteria, it's definitely communicable. Okay, immune system. So this is the system that is fighting disease for us, okay? So we're producing blood cells in response to infection, and our body is trying to kill that infection, destroy the germ. So not necessary to be familiar with all of the parts of it, but just the diseases, okay? So multiple sclerosis. This is the autoimmune disease, okay? So we know autoimmune means that we are what? What happens in autoimmune disease?
Immune cells attack healthy
Friendly
cells.
fire.
Yes, friendly fire.
Friendly fire. That's a good way to put it. So it's actually attacking itself, okay? It's attacking healthy cells. And those cells happen to be the nerve cells. And what happens is it's attacking the coating. So you see the coating of the nerve is being attacked. And so when you expose the nerve, you're going to have difficulty having this communication. And sometimes what you'll have, the signs will be mobility problems or numbness. You will stop feeling sensation, or you'll stop thinking properly. So it could be nerves anywhere on the spinal cord or the brain, okay? So if we think about the brain and the spinal cord, that's your central nervous system, and that's controlling any of the communication to your arms and your legs. So numbness, difficulty moving, vision problems, many things, okay? So there's no cure, but there's medications to slow the development. Sometimes it will come and go with people. If they have MS, it'll come and go and get worse and so on. But you also have physical therapy to keep your muscles strong, okay? So to preserve the muscles that you have. And then allergy. So this is the immune system reacting to something that is seemingly harmless, okay? But for you, it's causing your immune system to, get out its guns and start firing. So this can happen to anyone early, like in their life, or later on, but usually it is in families, okay? So in families, again, family history with multiple sclerosis as well, because autoimmune conditions are passed down in families. More women are more likely to get MS, but asthma can be in anyone. So if we look at the ways that we treat allergies, we can either have antihistamines, okay? So that is against the release of these immune cells, or we have a severe allergic reaction, which we called anaphylaxis. Okay, this is when anybody who has severe allergy to something, they need to carry their EpiPen or their auto injector of adrenaline. Okay, this will save their life. Some of those symptoms here to be aware of: so severe shortness of breath, a rash, a very rapid or weak pulse, and you may even lose consciousness. So if you have a mild allergy, you would never have severe shortness. You may have a little bit of tightness, but not severe shortness of breath. Okay, so we said that the protective covering of the nerve cells, the disease that attacks those and affects the communication between the brain and the rest of the body, that was MS. Okay, Parkinson's is also affecting your central nervous system, okay, but it is not attacking the coating of your cells like MS is. It's just the messages are not getting through, okay? But with multiple sclerosis, you're getting the nerve cells, the coating of the nerve cells is being attacked. Okay, so two signs and symptoms of MS are, which of these? Are they mobility? Are they development of muscle mass and strength? Are they tiredness and weakness? Or is it all of the above? Which are two signs? Anybody there? Okay, so with multiple sclerosis, we have mobility or movement problems because the messages are not getting through. You might have numbness, so you might have difficulty moving. And also you might be very tired and weak because your muscles are made to move with nerves. If your nerves aren't working, you'll feel weak. Okay, so we're looking at medical emergencies now. So we had a number of medical emergencies. The first one was head and spinal injury. So we can have a number of different head injuries. They can be either closed. So if we say we have a closed head injury, we mean that the skull is not broken. But if it is if it is open, that means that the skull, the bone, is actually broken and it might expose the brain. Okay, so the common head injuries we know of are concussion. So that means that the brain is shaken, okay, and you might feel dizzy. And then you might have a scalp wound, so you actually have a cut, but it's only the skin, and you may actually have a skull fracture. So that would be an open head injury. Okay, so when to call for medical emergency? So if you are dealing with somebody who's had a moderate to severe head injury, should always call for a medical emergency team, okay? They might become very sleepy. They may not be acting like themselves. They may be very different. They may have a severe headache or a stiff neck, okay? They may have this feeling of pressure in their neck as well if they've hurt their spine somehow. So all very emergency situations. Okay, so the signs and symptoms then of a spine injury, you would have numbness, tingling, loss of sensation, a sharp pain or pressure. Their neck might look a bit strange. They might have difficulty breathing. With a head injury, they may feel like they want to get sick. They may not remember what happened, so a bit of memory loss. They may even have a seizure, okay? So if you have abnormal activity in the brain, it can cause a seizure. Or there may be some swelling. So if you see swelling at some area of the brain, and their pupils. So you can see the eyes here. This pupil is very small, and this pupil is very big. So they're unequal. That's another sign of head injury. So if you have any of these injuries, if the person is bleeding, you're going to try to stop the bleeding, but you're not going to press on a head wound if you suspect the skull is fractured, okay? If your person is getting sick, if they're vomiting, if they've had a head injury and now they're vomiting, you should try to get them on their side, okay, on their side, but they should be moved all as one unit to prevent any damage to their spine. Okay, so this, I believe, was on your exam. So during a skiing sports competition, a player has fallen over and is lying on the ground. They have extreme pressure in their back and cannot move their legs. What type of injury is described? Is it bone fracture, spinal injury, allergic reaction, or airway obstruction? What sort of injury does this person have? Okay, it is spinal injury. So they cannot move and they have extreme pressure in their back. Which of the following is a type of head injury? So concussion, scalp wounds, or skull fractures?
Skull fractures. All of the above.
All of the above, that's right. Oh, you scared me then. Yes, all of these. So you could have just a mild injury like a concussion or just a scalp wound, or you could actually have your head your skull broken. Okay, so which of the following is not a symptom of a head injury? Which is not?
Vomiting.
vomit or allergic reaction, maybe.
Allergic
Allergic.
reaction.
Yes, allergic reaction. So if you have seizures or vomiting or amnesia, memory loss, these are all signs that you may have a head injury. Okay, so burns. We have first, second, and third degree burns. Let's just look at this next picture here. So if we have a first degree burn, we might just have redness. If we have second degree, we would have blistering. But if we have third degree, then we would have charred skin and possibly nerve damage. Okay, so those are the types of burns. So which of the following must we not do when treating a burn? Hold the burn under cold water for 10 minutes, remove any clothing, wear PPE, or put ice on the burn.
D. And A.
Yes. Actually, we can hold the burn under cold running water for 10 minutes, okay? But we should never put ice on a burn because that can actually cause more damage. But cool running water is fine.
Cool, but not cold.
That's right. Cool. Yes, cool. Okay, so what is the sign of a third degree burn? What did we say was the sign
Charred
of a third
skin
degree?
and nerve damage. Charred skin and nerve damage.
That's right. That's right. Okay, so the fracture, we had a number of different types of fracture, either partial or complete, okay, or displaced or stress. So sometimes they're just like fractures within the bone. Sometimes they're completely broken and moved apart. Sometimes they're broken, but they are not actually separated. They're still lined up. So we were looking at different types of fractures. So either closed or compound. So when we say closed, we mean that it's a simple fracture. It didn't go through the skin. Where's the picture? So it's not going to go through the skin here. But if we have something that is compound, we mean it's open. So it means that it's going to break through and cause a wound here on the arm. Okay, much more dangerous. So we would have signs of sharp pain, heavy bleeding, and so on. So very important when we provide first aid to immobilize the area, stop any bleeding, and apply ice, obviously not directly on, but you know, with a towel or some kind of fabric around the ice, but just to help relieve pain, but not directly on the wound, and then help cover them up if they're in shock. Okay, so which of the following best describes a compound fracture? So that's a bone through the skin,
A.
a bone too, yeah. So definitely a bone that's gone through the skin is compound, which is not, which of the following is not first aid for a fracture? Which of the following would you not do?
Apply ice to relieve pain.
Wash area
Okay.
with soap and water.
Exactly, yes. You don't want to touch, you don't want to do any movement or touching of a fracture, okay? Especially if it's open. You would never do any washing with soap or water, but you would apply ice just in a towel, not directly on a wound, but it would help to relieve pain to do that. Okay, so I think with the advanced students, they were asking you to be familiar with the types of fractures, okay? So spiral means that it's twisted all around the bones, not just in one area, it's around. Transverse, it means it's straight across. Go back. Oblique, diagonal, compression, so bones are just crushed. Okay, comminuted means there's many, many fragments, so little pieces of bone inside. And then impact means that it's crushed together, it's jammed together. Okay, so I don't have any questions on that one. So diabetic episode, this is probably going to come up. So making sure you understand how to respond to these different situations as far as the first aid goes. So if somebody has hypoglycemia, they have very low blood sugar, it could mean that they took too much of their insulin, okay, and now their blood sugar is very low. So it also could mean that maybe they missed a meal or they exercised too much. Okay, so they may feel dizzy, hungry, irritated, pale, shaking, or sweating. And so it's very important that you give them juice or some sort of sugary snack, okay, and check their blood sugar after about 15 minutes, if they're able to eat, that is. So if they're unable to eat, then you can put some honey or something inside their cheek and then monitor them. But if they're unconscious, obviously, or if you feel unable to help them, you should always call emergency. So hyperglycemia, very, very high blood sugar. This can happen if you overeat or if you're not taking the insulin or right amount of insulin or just eating too many sugary foods. Okay, so you're always, when you're given your insulin, you're given a certain diet to follow. So some of the signs that you would have would be increased thirst. You would have maybe a headache, blurry vision. You would be going to the toilet and urinating very frequently. So the first aid would be to change the dose of the insulin. If we need to increase the dose to get the sugar down, then they would do that, or they would have to be eating fewer carbohydrates and fewer sugary foods, or else exercising to use up the sugar in their blood. So what emergency medical advice would you give to somebody who has a hypoglycemic episode? So do we do some exercise?
B.
So they eat some honey or a sugary snack, that's right. So they need to get their sugar up if it's low. When might a diabetic hypoglycemic episode occur? So if a person has diabetes, when might this happen to them? If they eat all their meals, if the person correctly fuels their body before doing exercise, if a person does not use their insulin medication properly, or all of the above. When could this happen?
All of the above.
No. If a person does not use their
See.
insulin medication.
That's right. So if a person doesn't use their insulin medication properly, maybe they took too much and now they've taken too much sugar out of their blood, okay? Or maybe they didn't eat enough, but yes, that's right. Okay, so what should you not do when giving medical care to somebody who has been poisoned? What should you not do? So should you wear PPE? Should you approach?
D and C.
Okay, so it's actually B, all right? So if the scene, oh wait, no.
That's wrong.
That's wrong, hold on now, hold on. Oh, so this, sorry, this was what I should not do. Okay, so this is again one of those situations where you have to think opposite, so make sure you look for the not. So
Yeah,
you
right.
should not do, okay? So the approach is, let's see. So you don't want to approach the scene if it's unsafe, okay? You would always put the patient in recovery position if they start vomiting so that they don't choke. And if you can, wash or remove the poison from their skin or clothing so that you don't get any more further absorption. And of course, wear PPE to protect yourself. Okay, so allergic reaction, we said that they could be mild or severe. Okay, so helping somebody who has a severe anaphylactic shock, it's very important to ask them if they have their EpiPen and ask them if they want you to give it to them because that is what's going to save their life. If they don't, you need to get in touch with the emergency services immediately. So many different things can cause allergy. So common ones are to do with foods, Okay, many people have very severe allergy to nuts, even eggs, shellfish, and milk. Or somebody might just have a mild allergic reaction to animal fur, dust in the home, or certain medications might be very dangerous for people as well, certain antibiotics, and insect bites. So we know that even a bee sting can cause anaphylaxis. So mild symptoms would be just sneezing, runny nose. They might be itchy. They may be coughing a bit. They may even have a bit of swollen, like lungs or sort of swollen lips, or some area of their face or their skin might be like a little itchy rash. But if you have anaphylaxis, this is a severe swelling of this throat and mouth area, so making it difficult to breathe. Okay, what did we say was called the very serious allergic reaction? What do we call that? So we call that anaphylaxis. Okay, a severe allergic reaction. And what should a person with a severe allergy carry with them at all times? What do we call that? Do you remember? So we call it the epinephrine or the adrenaline auto-injector. So that's called the EpiPen or the adrenaline auto-injector. This is what somebody with a severe allergy should carry with them all the times. Okay, so stroke, I just want to mention is that you mentioned that it's fast. Okay, so you remember by saying fast, if you look at their face and it's drooping on one side, if you look at their arms and they're not able to lift one or both of them, or if their speech is slurred or they're unable to speak, or they have any of these symptoms, then it is time to call for emergency help, okay? They might lose consciousness. So the lack of oxygen is what is causing the stroke. So if you're basically having a blockage of an artery in your brain when you have a stroke. It's like a heart attack in the brain. Okay, so either the blood vessel has ruptured or it's blocked somehow. Okay, so you should call 999, get a first aid kit, take note of the time that the person had a stroke, and stay with them until emergency comes. Okay, so when we say there's a lack of oxygen to the brain, it's always a stroke. I'll just go quickly through the rest of these now. So your friend is complaining about weakness in their arms. When you ask them what has happened, you notice they have difficulty speaking, so that is a stroke, okay? You're thinking fast. Face, arms, speech. Seizures, we said this can be caused by abnormal activity in the brain. So what happens is that your body is uncontrolled, okay? The muscles are contracting because of the abnormal electrical activity in the brain. So your muscles are contracting and twitching. This could be because maybe you had a head injury or lack of oxygen, or maybe you have a reaction to medication. Okay, so all of these things can be the cause of seizures. If you are a child, sometimes you can get a fever and you can cause a febrile seizure. So this is a seizure that's caused by a fever. Okay, and the first aid would be just to make sure that there's nothing in the way of their head that's going to hurt them, moving any furniture items away and putting a pillow under their head, not holding them down, but just staying with them until the seizure stops. Okay, so poisoning. If we have, if we suspect somebody is poisoned, we should always call for emergency, okay? and we should stay with the person if we can understand what maybe is around them, maybe a bottle or a smell on their breath. Okay, so a lot of these things can tell us whether or not somebody has what they've actually been poisoned with. So it could be something they were inhaling. It could be something that they swallowed, and so on. So they may be acting drowsy or confused. They may even have seizures as well. Okay, so what did we say was the sudden attack that occurs when there is abnormal electrical activity in the brain? What should we call that?
Seizure.
A seizure, exactly, seizure. And then if you find a casualty who is unconscious, there's a chemical smell on their breath, and there's a bottle of bleach beside them, what type of emergency? Is it an insect sting? No, it's poisoning. It's poisoning, okay? All right,
Okay.
so dehydration, finally, dehydration. So if you have not drank enough water, you can feel just thirsty, okay? So it's important to think about some of the symptoms of each of these degrees of dehydration. So if you're just dehydrated, you haven't had enough water, you might feel thirsty. You might be a bit dizzy, okay? And your urine would be very strong, maybe dark yellow. So if you are exhausted, if you have heat exhaustion, maybe you've been running a marathon, then you are going to be overheated, okay? So you could be heavily sweating, you could be very nauseous and dizzy, okay? So you should lie down and you should try to help cool this person with some water, okay? And if they're not feeling well after 30 minutes, then they probably have heat stroke. So this means that they could potentially have a seizure. Their body temperature is over 40, and they may become unconscious or unresponsive. Okay, so definitely call for emergency, and even put them in cool water if you can. Okay, so how to avoid, obviously, drinking enough water and keeping something off you, keeping the sun off you by carrying an umbrella or putting sunblock on. So which of the following could be signs and symptoms of dehydration? Does anybody want to choose the three? What would be a sign of dehydration?
Feeling thirsty.
Yes.
Dry
definitely.
mouth and lips and eyes. Dark yellow
Yes.
strokes.
Yes, excellent. Okay, and then which of the following would be symptoms of heat stroke? So heat stroke is the most severe. What would be three signs of heat stroke? So would it be sweating? Would it be sweating or not sweating, even though you're too hot? A temperature of 40.
Not sweating.
That's right. So if you have heat stroke, you're not going to be sweating. That's right. Only if you're heat exhausted would you be sweating, or if you're dehydrated, you might be sweating. But if you have heat stroke, you don't have enough body fluid to actually sweat anymore. So you're above 40 and you possibly could get seizures. Okay, so for heat exhaustion, you could still also have seizures. You would also definitely be sweating excessively, okay? And you would feel, you would have this temperature of 38 or above, okay? So heat exhaustion can happen at a very kind of lowish body temperature, 38, but it's still raised a little bit, but you're feeling very thirsty and you're sweating a lot and seizures. Okay, so airway obstruction can be caused by a number of different ways. Okay, so if you have something caught in your esophagus, then it could be either your tongue. Okay, so you might have a swollen tongue. You might have a foreign object such as food stuck. You could also be having an allergic reaction where your throat is swelling up, or you might have an infection, which is also causing swelling. So your airways can be obstructed by any of those means. Okay, guys, so that is it for the review. I will stop recording and